Good morning. I'm Dr. Roberta Lavin, professor at the University of New Mexico College of Nursing. I'm also the chair of the planning committee for this event. Welcome to From Hurricane Katrina to Paradise Wildfires, Exploring Themes in Disaster Human Services, a workshop focused on children and youth in disasters and hosted by the Forum on Medical and Public Health Preparedness for Disasters and Emergencies of the Health and Medical Division of the National Academy of Sciences, Engineering, and Medicine, and supported by the Administration for Children and Families. You can find more information about the MedPrep Forum in your briefing book. Thank you for the attendees, speakers, and planning committee staff, Scott Wallach, Aurelia Atal Janqua, and Laura Ronells, as well as the other National Academies of Science, Engineering, and Medicine staff present today to help us run this workshop. We have a great slate of panelists on our agenda who will be sharing with us via presentations, discussions, and breakout sessions. Speaker bios will not be read in full, but are provided in your briefing books. We invite all audience members to engage in the workshop activities. You can engage in discussion with other audience members in the chat box. We will also be sharing resources mentioned by the speakers there. Let's practice that. Please share, if you haven't already, please share your name and locations in the chat box. The chat box will be monitored by the National Academy staff. Please submit questions for the speakers and panelists in the Q&A box. The questions will also be moderated by the National Academy staff. We will be using breakout rooms in one session later this afternoon. And for this, we have created 4 additional Zoom rooms for each breakout session. You can join these Zoom rooms using links that are in the briefing book that was provided to you or the expanded agenda. We'll also be resharing those links in the chat box a little before 1 p.m. today. If you are having technical issues, please use the chat box to send a message to the participant IT support in the chat box list. The workshop is being recorded. Please make sure to identify yourself, name, title, and affiliation when you provide or ask questions. A workshop proceedings, which is a reasonably accurate and objective summary of what occurred at the workshop, will be authored by the rapporteur with the assistance of Academy staff. The proceedings may contain particular viewpoints attributed to individual participants or groups of participants in the workshop. The workshop is designed to meet the following objectives. Understand the critical child care infrastructure, for example, the existing systems and networks of human and social services that serve children and youth, and how it functions, how services are delivered before, during, and after a major federally declared natural or environmental disaster. Understand the impact of disasters on children and youth that benefit from human and social services providers. Understand the current gaps and future opportunities for supporting the coordinated delivery during the restoration of services following major federally declared natural disasters. And finally, explore potential matrices for evaluating response and recovery efforts related to human and social services. The scope of our workshop is designed so that we focus on children and youth between the ages of 0 and 26. We specifically wanted to focus on people who are already receiving public supports. So people that had socioeconomic deficits before the disaster or naturally occurring event. We wanted to focus on disaster response coordination and transition to reconstitution of routine service delivery programs by state, local, tribal, and territorial human services and public health agencies. And look at promising practices and ongoing challenges, as well as making sure that we keep our focus on children. We specifically chose to avoid covering COVID-19, and we did that because right now it's receiving a lot of public attention, and it will in the future. But we know that human and social services and disasters have often not received the attention of public health. And in this case, we wanted to focus on those disasters and look back and try to see what was done well and what best practices we can learn from. So let's get started. I'm going to stop sharing my screen, and I am going to introduce you to our first presentation. Our first speaker, our first presentation today is going to be the rationale that will be given to us by the Administration for Children and Families. I'm delighted to introduce Scott Leakin, Principal Deputy Assistant Secretary and Acting Commissioner of the Office of Child Support Enforcement in the Administration for Children and Families within the U.S. Department of Health and Human Services, to provide welcoming remarks.
Good morning. Roberta, can you hear me well?
I can hear you very well.
All right. I always like to check that. You just never know. So thank you. Greetings and welcome to all. Thank you for taking the time to join us today in this very important discussion. As previously mentioned, I serve as the Principal Deputy Assistant Secretary for the Administration for Children and Families, and I also serve as the Acting Commissioner for the Office of Child Support Enforcement. I want to express my sincere gratitude and appreciation to the National Academies for coordinating and convening thought leaders on this really important topic. I also want to thank our OSEPR, our Office of Human Services Emergency Preparedness and Response, for their work in supporting this convening. Our agency is committed to using promising practices and the best information available to adjust our service delivery models and meet people where they are at. I recognize that these meetings will consume a large portion of your workday, and I am encouraged to know that you value this issue area significantly enough to learn with us. In my position as the PDAS, I support Assistant Secretary Lynn Johnson in managing the daily operations of the 64 programs and 16 program offices within ACF. The immediate office of the Assistant Secretary is the intersection point for all ACF's programs as we support individuals, families, and communities in crisis every day. We know how challenging it is for our citizens on a daily basis because we are the direct service providers that support them, or we walk with the direct services providers every day. Our agency is the largest human services grant maker within the Department of Health and Human Services. We provide about $58 billion annually through direct funding to households in grantee community and jurisdictions. These funds are designed to provide communities with the necessary services to support their economic resilience and develop individuals by centering their life experience in human service delivery models. Our programs support a wide range of human and social services, including early childhood education, support for abused and neglected children, trafficked persons, and survivors of domestic violence, as well as temporary financial assistance in job training and education. Over the course of the session today and tomorrow, you will hear from thought leaders in emergency management and disaster operations who have a specific focus and expertise on unique issues affecting children and youth after disasters. This conversation is particularly timely as we are actively engaged with the ongoing threat of COVID-19. And I know we weren't going to specifically talk about that, but I know that that right now is an issue that we are all concerned about. We are also in the middle of hurricane season and looking ahead to wildfire season as well. We also know that still communities are recovering from wildfires across California and rebuilding from hurricanes and earthquakes in the Caribbean islands. Communities are often subjected to multiple traumatic incidents that compound challenges they may encounter daily. Children are not little big people, and our actions in support of their development, especially as they process trauma, should keep this at the front of all interventions. After a disaster, our focus should be to provide appropriately targeted support to the impacted communities, especially the most vulnerable. The opportunity and challenge we have ahead of us is not only to discuss the impact of disasters on the children and youth, but to identify a path forward as we confront increasingly complex and layered disasters. Our Assistant Secretary has focused on increasing childhood adoption, primary prevention, and supporting families' economic mobility. ACF believes in promoting person-centered, whole family, integrated, and streamlined services to move from a compliance delivery model to measuring outcomes. Primary prevention is that ultimate umbrella that we hold over the entire agency. With primary prevention, we continue to stress not only our economic mobility efforts, but really all the aid needed to individuals as they return to work and the supports they need as they return to work. After a disaster, we know that childcare efforts are critical to getting caregivers back to work in the economies of communities running again. We have found that it is important to include unusual hour care, family, friend, and neighbor care, as well as center-based care. And you'll hear more about that from our incredible office director in childcare. In helping people and communities recover economically, a healthy childcare system that enables people to work while safely supporting childhood development is critical. ACF is proud to be working across federal agencies with HUD, Education, and the other HHS agencies such as SAMHSA and Public Health, and very importantly to us, our Administration for Community Living. I know that this session will communicate key facts and equip you with strategies to enhance your awareness and provide resources for referral when encountering these difficult circumstances. I encourage each of you to take one key message back to your agency or constituency and spread it broadly. I further challenge you to keep this topic in mind and seek opportunities to incorporate this knowledge into your ongoing disaster readiness activities. Thank you again for your time, and I know that I and we are all appreciative of your willingness to learn about this important topic. Thank you, and back to you, Roberta.
Roberta, I think you're on mute.
I was. Sorry about that. Thank you very much for those opening remarks. Now, Natalie Grant, Director of the Office of Human Services, Emergency Preparedness and Response, will provide a brief overview of the rationale for the workshop.
I'll go ahead and get started in the interest of time because I know that everyone wants to hear from those most important folks, the speakers and presenters who have just an amazing lineup ahead of you. So just really quickly, who are we? I really engage with disaster human services as this kind of patchwork quilt that we are oriented to. Oh, hang on a second. All right, Aurelia. We will get to those slides. If you want to just put it in presenter mode, and I'll just move through it really quickly. So disaster human services is very much about knitting those patchwork quilt of various human and social services that are delivered day to day. To the PDAS's point, 64 programs that touch the lives of Americans every day, especially those who are most vulnerable. So as we look ahead to some of our work, why are we even focused in on disaster human services, and why are we starting from Hurricane Katrina? To be honest with you, like that was really the genesis of our office in Human Services Emergency Preparedness and Response. On slide 6, if you could advance to that, please. The Hurricane Katrina White House report really identified that the chief challenge of many for human services, though, for Hurricane Katrina was this disconnected network of independent actors and programs and services that were not very well coordinated to meet the needs of the disaster survivors as they looked ahead. So the directive that came from the White House to HHS and then was subtasked to the Administration for Children and Families resulted in the creation of OSEPR, our Office of Human Services Emergency Preparedness and Response. So if you could advance one more slide for me to slide 7. And the focus of our office is really to coordinate all of those ACF programs and more broadly in partnership with other human and social service providers that PDAS Lacan really touched on, between substance abuse, mental health services, our Health Resources Services Administration, Centers for Medicare and Medicaid, and our Administration for Community Living. All of those entities that have programs and touch points with the lived experience and those human and social services, we're really designed to help facilitate that coordination after a disaster. So if you could advance to slide 8 for me. ACF programs fit into this disaster space pretty neatly. Chiefly, we are, to the PDAS's point, seeking to leverage community supports through community hubs, right? We want to meet people where they are at and where they can best receive those services as well. So part of that is understanding and acknowledging the critical role that the community members and that knowledge base has, in addition to really being flexible with our programs. We have disaster flexibilities and waivers. We found that over time and each disaster, we get a little bit better at knowing and understanding the contours of what may manifest and how best to support it. So where are we going as we look ahead? We're really looking ahead to, on slide 10, the national priorities of supporting the construct of a coordinated national disaster human services capability. That includes focusing in on individuals, families, and especially children and youth as they negotiate the aftermath of disaster and ready themselves for subsequent disasters and emergencies. We want to make sure that we're developing those effective partnerships to execute the department's mission for health and human services as part of Emergency Support Function 6, Public Health and Medical. And then also looking at outcome-oriented solutions. And that's really why we turned to the disaster science base. We want to make sure that, as part of the last slide, slide 12, we wanted to make sure that we were working in partnership with the experiential community, with the science community, so that we're developing a suite of tools and resources and really focusing our effort on what makes sense and what has been tested and examined over time. We recognize that there was not necessarily a body of knowledge through which we could, on which we could lean for this, and this is the start of that. So I look forward to the conversation today to really help us develop that roadmap for development of timely, coordinated, and appropriately targeted human services after a disaster. So stay tuned. We have additional workshops upcoming, and really looking forward to the workshop session today. Turning it back to you, Roberta.
Thank you. We apologize for the slides being somewhat delayed, but we will make sure that we get that back to you and that you'll have access to those. So let's go to the audience. If you have questions or comment about ACF's vision for the delivery of services during and after disasters, or the purpose of this workshop, please provide them in the Q&A box. Remember to state your name, and affiliation for the record. So let's go to audience questions or comments. Now, considering all the people here, so my question is to you, Natalie, is that while we're waiting on others, and having worked in the federal government, I'm surprised people are so silent. They usually take this opportunity. You've done a lot of work in ACF to grow the program that addresses human services, emergency preparedness and response. If you had to say what you think you hope to get from not only the panelists, but the audience, what is it you're hoping to gain from this workshop?
I think it's very much about the intersection, right? So within the federal government, we all have pretty well-defined authorities and lanes within which we operate. However, that's not how people lead their lives, and that's not how disasters work. And when we're thinking about the response and recovery and reconstitution of communities, it is the critical points that I've seen have been those connectors. So how does human services connect to public health to contribute to the social determinants of health? You know, on our side, we put the emphasis on a different syllable. We focus on the social side, and our colleagues over at CDC and otherwise focus on the health side. But it is one unified phrase, and how we look and work across that is critically important. I'd say the second thing is very much about how we're preparing and supporting those providers to engage with the disasters and their aftermath. If we can get them up and running faster, the folks who know and understand and can better support the communities of interest, then they have a longer, they have a much better path, a better arc for that recovery process. So we're really trying to push things up in the response space and say that, hey, this can't wait. When we're talking about children and youth, when we're talking about communities, it's not enough to say we're going to wait. We need to advance the conversation earlier in the disaster.
Well, we have a question from Converge, and they asked, they said that you talked about Katrina and how that impacted the creation of the office, but what other disasters have led to changes along the way in terms of your leadership at ACF?
What we've noticed increasingly, thanks for the question, over just the past few years is that Congress has been pretty laser focused on human service delivery in the aftermath of a disaster. That is to say, we've received congressional supplemental appropriations following Katrina, following Hurricane Sandy, then the hurricanes in the Caribbean, and then the California wildfires. So I don't think this is going away. And I think that we're learning across each disaster. However, learning by disasters themselves, and just because of the frequency and how quickly we need to turn on that process improvement has really led us to a point in a space where we really need to spend more time focusing in on not only lessons learned, but implementing those changes in a rapid sort of agile project improvement process.
Okay, and then I have a question from Patricia Falls. What ACF open access data and resources are available to help local communities do this communication?
I think part of it is from the federal government, we have the tag system, which indicates all of our grantees, especially from ACF across the country. That is open source, it's readily available, so you can have a sense of who's receiving what grants for what services within your community. Now, that is just a data point. It is a data source. It doesn't necessarily point to how you can go forward in that coordination. And I think what we really want to receive from the community of practice is a better understanding of where those hiccups are, where are the challenges. We've heard from some of our other practitioners that they may not have relationships with their public health entities, they may not have relationships with their emergency managers, or their role is very specifically defined within a particular lane that has not necessarily touched on how they're actually delivering services to their vulnerable populations day to day. So I'm interested in hearing back from you, like, what are your challenges in coordination? What would you be seeking from us as we start to develop and better understand how we can engage with our federal partners and really push that message out?
And we have another question, and I would and it is, there is gathering evidence of child trauma, ACE, an important predisposition to later life OPTSD in the face of adult disaster exposure. What is the current status about this association? Now, I know that is a big question for me to read out, and if you need to refer that to later panelists, that's okay.
I'm going to kick that to the later panelists, and Dr. Deb Bergeron, I know from ACF, is very much focused in on our ACEs. Honestly, all of our program leadership, and that's really what our principal deputy spoke to in terms of child trauma and primary prevention. All of our programs are laser focused in on this, and I think you'll hear a lot more about what that means and looks like later today.
Okay, and I apologize to the professor that asked that question for not even trying to pronounce her name or his name. So we have another question from Heather Bill Blocks. It says, I think it's important to have this discussion, and I think it will be very informative. Whoa, that jumped way across. I don't know where that question went, guys. All right, I'm going to move on to a different one. What efforts have been established to promote collaboration of different agencies in preparation, recovery, and mitigation?
So we at ACF work very closely with our partners over at the Federal Emergency Management Association, FEMA, in individual assistance, because they deliver the mass care services, and there is just an acknowledgement that they're very much about sort of stopping the bleeding, to borrow from a healthcare sort of analogy. But they also recognize that they don't exist in that steady state space. So they only know what they are encountering upon that deployment. So part of our conversation is about what data do we share? What information do we share? How do we support each other? How do you understand the broad scope and spectrum of the disaster incident and the impact on the populations that we're supporting? How do we appropriately allocate resources and target them to those folks that may need them the most? And then how do we also make sure that we're supporting the community writ large as the sort of disaster need, or the disaster cause need rather, ebbs and flows? And I think you'll hear a lot about that through some of the participants and panelists as we move through the day, and just how they're engaging with that process. But we talk to our partners on a routine basis and really try to match up our steady state programs with the emergency incident, such that we can have that sort of all of those swatches really stitched together.
And I think we have time for one last question, and it's from Cindy Calderon that says, how are the needs of the affected community assessed, and how's the community involved in all aspects in dealing with disasters? So my translation of that is, how do you work with the community?
Well, you know, as a federal entity, and ACF is pretty unique. I think we, as the PDAS mentioned, we have grantees, we provide direct services, we work with state jurisdictions. So we're slightly different from FEMA and some of our other federal colleagues, in that we don't deal exclusively or work exclusively with our state partners. We work also with direct service providers. So it can get a little bit dodgy, but I think part of the benefit is really that we get a more holistic picture of what's happening, where the challenges across the various organizational levels in service provision. So I think what we would also be seeking from you is better information about what are the challenges that you face and encounter, how can we improve upon them, or even just like, what are you don't even need to have a recommendation right now. Right now, we're still in the issue identification and just kind of naming it and categorizing it so that we can develop a process to engage with it.
Well, thank you very much. We have come to the end of our time for this session.